Good morning, Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and delighted to be back with you on this beautiful Monday morning, especially after a big Chiefs win out at Arrowhead Stadium yesterday. That was a lot of fun, made me feel almost normal, except the stadium wasn't quite as loud as it normally is. Here with Doc Hawk, and I know we're both happy to be back here with you. We have some really special guests this morning because we have the Chief Medical Officers for several different hospitals that are going to be joining us here on the line in just a moment. But first, Hawkeye, how are we doing today?
Hi. You know, we're doing good, and I think we just need to continue to reinforce that we will have ups and downs, highs and lows of the number of patients in the hospital. Certainly, we're down right now from where we were at a peak last week. Right now in the hospital, we have 35 active infections, 14 in the ICU, and 8 of those on the ventilator. We still have 31 patients in the hospital, though, with 6 of those on the ventilator in that recovery phase. So it's not quite 70, but it is in that 60 range, certainly much higher than that 40 to 50 total active in recovery. And then in Hays, their numbers have gone down a little bit as well. They have 17 total patients. 16 of those are active, and 1 is in that recovery phase. I think the real concerning part, though, is if you look at kansascity.com that accumulates the numbers for our metropolitan region, we have almost 500 new cases a day, and that is almost up to the peak, I believe, in July where there was for this 7-day rolling average. So our 7-day rolling average has continued to increase now for several weeks.
And the rolling 7-day average or 14-day average that's posted every day, and you can find that thing that either Hopkins or I look at the New York Times because they make it simpler for me. And you know, we're up by 40 or 45%, which is a crazy high number.
Yeah.
Also, last week I quoted some numbers from El Paso, and I think I didn't say it exactly as I should have. This is the correct graph for those of you that may be out there. It's a COVID-19 report, and you can access this article at epstrong.org. But it demonstrates that their current number of acute patients is up to 14,000. And that's the problem. And so they're getting about 1,400 in, or 1,700 in, and 1,400 or 1,700 out, because it's I think you have to be within that 10-day window. And you can see how exponentially that number is growing and hasn't flattened yet. And I think El Paso hospitals are overwhelmed. The reports of one hospital at least that had hundreds and hundreds of COVID-19 patients hospitalized, and I think there were 601, and 200 of those folks were critically ill. So I think it just demonstrates where you can end up if you're not really careful with the pillars of infection control, because as we say all the time, the pillars of infection control travel with us wherever we go. So today, let's see first, are there questions from media? And then we need to think about how we want to introduce our Chief Medical Officer. So first, let's see if there are questions from media out there.
Hey, good morning, guys. It's Taylor Henderson, Channel 41.
Hey,
I have a question about Election Day tomorrow, obviously. We've got a lot of people headed out to vote tomorrow. What would you say to people about if they wanted to add an extra piece of protection on top of the mask, whether it be goggles or gloves or a face shield? Just reminding people how effective, and if they're only going to pick, one of those, which ones are maybe the most important or not quite so important as they head out to vote tomorrow to protect themselves.
That's a great question, Taylor. Thank you for asking that question. So, yeah, I think clearly face masks are important. After that, I go with eye protection because, what I know is from voting already that there will be a great deal or a lot of infection control precautions. You're going to have a lot of hand sanitizer there. So I don't think you have to worry so much about gloves, but I think either a face shield or goggles, Hawk.
Yeah, absolutely. Totally agree. The goggles, which we have shown.
We have shown, and we've got them again.
So not just eyeglasses, but actual protective goggles that
you know what? We rock the goggle look. I think we were so good. Don't you think we look good like that?
Yeah.
Yeah, we're rocking it. Let's go.
Awesome. Or the face shield. So I think that, and you're covering up your third mucous membrane, which is your eyes. That would probably be the most important part.
And you don't need both the face shield and the goggles.
No,
that you don't need. One or the other, really, right?
Right. You need the mask, and then either the face shield or the eye protection with the goggles.
Yep. And you got yours at the hardware store?
These were given to me by another physician who got them at the hardware store.
Okay, and I got mine off Amazon, so there you go. You can get them in a lot of places. All right. Other questions? All right, without hearing any, I want to turn to our chief medical officers who are with us this morning. And I'm going to first start with Dr. Raguadega, who is the chief medical officer at Liberty Hospital up in the Northland. I think we're also joined by Dr. Mark Steele from Truman Medical Center. And I don't know, Larry, are you on? Larry Botts is the chief medical officer over at Advent Shawnee Mission. Larry, are you on?
Yes, I am. Yes,
awesome.
I am, Steve.
All right. Wasn't sure if you were there. So first of all, I'm going to go with you, Larry, because you and I are a lot alike. We're both pulmonologists, and we're about the same age, and I don't do PowerPoints. So these other guys, they brought some PowerPoints that are pretty cool. But tell me what's going on over at Advent.
Yes, well, you're right. I don't do PowerPoints very well either, so you're going to have to put up with my just my narrative. Well, at Shawnee Mission, we've been relatively stable over the past 4 months, but a lot of the same fluctuations that everybody else in the city has seen from our COVID cases as they have gone up and down. Basically, kind of staying in the same range. Our hospitalizations stayed between 15 and 25 throughout most of that period. However, what has changed a little bit is our non-COVID population of patients has been a little bit higher, particularly in the last month or so. And so intermittently, we have been experiencing some capacity issues, as most hospitals, in the region have. Some of our capacity issues are related to staffing, which has also become a little bit of a problem metro-wide. Shawnee Mission is doing everything we can to make sure that we have the staff that we need. We're still able to care for both our COVID patients and our other patients requiring care, but there is a concern that as the respiratory illnesses increase, as they always do during the winter months, as you know, that we may find there is a concern that as they increase, we'll find ourselves in a difficult situation. This just emphasizes that we need to remain vigilant regarding those precautions so we can take to keep the spread of COVID and all of our respiratory viruses to a minimum, so that at least as a region we can continue to take care of those individuals that require care, both COVID and non-COVID. Our COVID patients recently have been a little bit younger as far as the demographics are concerned, a little less ill. However, we're still seeing patients who require ICU care and mechanical ventilation. I think overall the length of stay of our COVID patients has decreased, both because they tend to be a little younger and less ill, and also because I think we as a healthcare organization or healthcare in general have become better at treating this disease. So I think in short, my advice is wear your mask, keep your distance, wash your hands, and get a flu shot.
All right. Boy, that sounds perfect to me. So, Dr. Adiga, how are things up in Liberty? And Larry, thank you for that. Sorry, it's great.
Thank you for inviting me back. Well, here in the Northland, it's been a little bit hectic in the last couple of weeks as compared to the entire metro. If you see the Clay County Health Department data, they have actually been seeing at least around 35, 36 new cases a day in their jurisdiction in the past week or so. The week before it was around 30, and the week prior to that less than 25. And we see the same thing in the hospital as well. Today we have 31 patients who are COVID positive in the hospital, 3 in ICU, 2 on vent. Out of those, 26 are in isolation. I've got a slide. Well, I do PowerPoint, I'll tell you. So
yeah, I wouldn't be able to do that, but go ahead.
Well, I've got my first slide up there. That's just to give you an idea of a snapshot of how things were at Liberty on Friday. At that time, we had 35 in the hospital, and just to show you, the age range was anywhere between 32 and 100. But interestingly, 7 of those were, less than 65 and 28 in the Medicare age. And about 10 of them had been here well over 7 days. And interesting that we have this increase in patient population coming both from the long-term care facilities as well as community. 14 of those 35 were from long-term facilities, and 21 from the community. And of those community cases, only 9 of them were from Liberty and Kansas City, Missouri, and another 10 came from rural areas a little bit up north. So we've been seeing both of those. And I'll talk a little bit about our patient population on the next slide. This is just to show you how things have been at Liberty since late March. We see a small spike in around April, then it came down. In fact, there were a few days we had no patients, no COVID patients in the hospital. But in July, again, it went up. But we never went past 15 at a time. But in the last 2-3 weeks, as you can see at the end of the graph, we really have gone past 25, 30. It was, I think, mid-September when we had single-digit numbers. So the numbers have certainly gone up. On the next slide, you can kind of see the age groups and what we've seen so far. For the past several months, we've treated about 307 patients. Of those, nearly half of them were less than 65 years of age, and in fact, 1/4 were less than 50 years of age. And we did lose about 32 patients, and of those, nearly 25 of them were older age group. So bottom line is, I think in the Northland, the hospitalizations are increasing, and it's coming both from long-term care in the community and some from the rural areas up north. And there are plenty of sick people in our hospital. And we do, just like what Laddie mentioned, we do have our staffing challenges like anywhere else. We never turned away any ambulances, but we've been close to direct admissions on a couple of occasions. So I still want to tell people, the same thing as Dr. Bach said, when people don't take COVID seriously, hospitals and the schools and businesses have to pay the consequences. So we really need to pay attention to wearing masks and social distancing, and more importantly now, avoiding gathering as the holidays are coming.
Makes sense.
Yeah.
All right, so thank you for that report. This is really helpful. It's great to see the different, how we're all doing differently. And Mark Steele, Truman, talk to us about how things are going at your hospital.
Yeah, good morning, Steve, and thanks again for having me on. And it looks like I may win the prize for the number of PowerPoint slides today.
No worries.
Winner, chicken dinner.
Although I will cover them quickly. Currently, our inpatient numbers have actually ticked down some from recently. We currently have 23 patients in the hospital, 5 are in the ICU, and 1 is on a ventilator. And the first slide that I'm showing basically shows the roller coaster of our inpatient numbers over time. And I think, as already mentioned, we had, like everyone else, kind of a small peak in in mid-April, where we actually had 12. And then as things were shut down, our numbers dropped down, but then began to climb, obviously, when reopening occurred. And our peaks have been at 36. We hit that peak of 36 once at the end of July, and then again right at the end of April, early October. And then since then, our last couple weeks, we've mostly been in the 20s. The next slide shows our COVID admissions and discharges by month. And as you can see, our highest numbers of admissions came in July and August, and we were down slightly from those months in September and October. And then finally, the last 2 slides, actually, I kind of mirrored what Dr. Wild had done in the presentation for KU. And the third slide, I'm just going to hit a couple high points. And actually, I think our results were very similar to what you all have seen at KU. Obviously, we've had more hospitalizations in September and October compared to the early months. Also, our hospitalized mortality rate was lower in those latter months. And also, the average age of our hospital deaths dropped down as well, similar to what you guys saw at KU. And then finally, that fourth slide just shows our overall numbers. Like you guys at KU, close to 25% of our hospitalizations have required ICU level care. The average age of our admissions has been a little lower than what you guys have seen. The age range of our deaths was very, very similar, almost identical. And then you can see that to date, we've now performed over 63,000 tests. A couple things I might also mention, we recently began flu testing. We've performed now over 180 tests, and none of those so far have been positive for us. We're on the verge of being able to offer COVID saliva testing and are hoping that will be available this week, so we're excited about that. You may be aware that the governor was at Truman just over 10 days ago and announced that they would be loaning us a new Fluidized saliva testing platform, which was created in conjunction with Washington University in St. Louis, including the WashU machine. They will be at 5 regional testing sites in the state, and we'll be the only one for Northwest Missouri. That testing equipment could be delivered to us within the next 2 to 3 weeks. After that, of course, we have to get it installed, train our staff, and do the typical validation. But hopefully we'll be up and running with that by the end of the year. And obviously that's also contingent on us being able to get the necessary supplies and get some equipment automation accomplished as well. But we could potentially double the number of, double our testing capacity.
That's awesome.
Our 404 care, pardon me?
So that's awesome.
Yeah. So we're very excited about that. Our 404 care line, which is how people access our testing, we've had over 60,000 calls to that since the pandemic started. Similar to testing, we also hope to be very involved with the administration of the COVID vaccines once they're available. Our tentative plan is to provide the vaccine as a drive-through service like we currently do with testing, assuming that's possible. And we obviously have a group working on that. And then I would echo what my colleagues said, and what you all said. Obviously, the 7-day rolling average is actually what I saw today is the highest that we've had. And obviously, the more infections generally results in more hospitalizations and more deaths, which is exactly what we don't want to have happen. So taking care to follow all the infection control precautions that we've talked about, and in particular really concerned about gatherings for the holidays and really thinking twice about those, and in this COVID year thinking about postponing those till next year or keeping them very, very small.
Well,
so that's
thank
what's
you.
going on at True.
Yeah, that's a great report, and congratulations on getting the saliva thing. Hope that gets up and going soon for you. That's awesome. I know people prefer that over the nasal swab. So,
Yeah.
All right. Well, I heard there may be another media question.
I believe Cody from Channel 9 is on board with us and has a question. Cody?
All right, Cody, how are you?
Hey, great. Can you guys hear me okay?
Yes.
All right. I was just had this follow-up for the chief medical officers. How much longer until local hospitals reach their stress point because of COVID-19? We're hearing about, and you touched on it a little bit down in Texas too, hospitals being overwhelmed. Are we there now? What's the outlook on that? And I guess what's the most important piece of information for the public to know about this situation, what you guys are dealing with every day?
You bet. Well, first of all, the most important piece of information is that we've bent the curve before and we can bend it again. And it's all about following the pillars of infection control. And I think we all know that so much. We say it all the time, but really following it. And I was out riding my bike on Saturday with my wife, and we were riding around, and it was getting a little bit later, about 5 or 5:30, and we started seeing kids out and then parents out. And then when there were a couple of large group gatherings of parents, and it was like nobody had masks on. I'm like, you know, this is not the way you want to treat COVID, nor especially you don't want to be spooked by COVID on Halloween. So I think it's continuing that message of trying to get people convinced that it's real. You see it in 4 different hospitals today. We've shown you our data. We've been very transparent. And I think the overall message is you can bend the curve, but you have to follow the pillars of infection control. And those pillars are they're a pain, right? And it's all about wearing a mask and washing your hands and keeping your distance. And those things are hard. But we want to do that because hospitals are getting busier just because it's that time of the year, and we tend to be busier in the late fall and into the winter. And what we're concerned about, and what I think Fauci was talking about over the weekend was, look, guys, if you don't change your behaviors, we're going to get in trouble. We're already fuller than we've been. So, Mark, are things pretty full over at Truman these days?
Yeah, I mean, we always run pretty full. We have been fuller than we are right now. I mean, and one of the indicators of that for us, and I think even for others, is how many patients we're holding in the emergency department at any given time because we don't have a bed to put them in, or we don't. And also, we're challenged, as was already previously mentioned, with staffing. I think we're all competing for the same limited group of staff. And so right this minute, we're okay, but that can change, I mean, very quickly within a day or two. And so we obviously have concerns when we see these numbers of infections creeping up, because the next thing we know, we're going to have more patients showing up at the hospital.
Yeah. Raghu, what's your sense?
Yeah, it's the same. I mean, it's that time of the year when we have our usual patients, and you add another, 25, 30 extra COVID patients with that. So we are stretched thin. Same kind of staffing issues. It's not the physical beds that we are worried as much about as the staffing challenges, and extra time that patients end up taking in the overflows. So we're able to manage right now, but we are concerned about, if this continues to get worse, we'll have to be watching very closely.
Larry, your thoughts?
Yeah, I don't have a whole lot to add to both of those. I think that both of them stated it very well. We are busier this time of year. This is the time when hospitals are often close to capacity, and we may have to hold people in the ED. We're doing okay right now. We've had our ups and downs in the last month, but still able to manage. It won't take a lot of increase in either non-COVID or COVID patients to stress us. And again, I will say that the staffing issue is one that we have as well.
And Hawk, right now, what's our total number of COVID patients or COVID recovering here in the hospital?
Right now we have 35 active, 31 recovery, so that is 66. Yeah.
And our total number of COVID patients recovering or acute are in the ICU right now?
In the acute we have 14. 8 of those are on the ventilator. We do have 6 on the vents that are in that recovery period. So they've been here,
more than 10 days.
Yeah.
So here's the challenge for us all. So first of all, our staff sometimes gets COVID, and so we have some staff who are out, and I think all of us are experiencing that. So that hurts a little bit. We're able to staff all of our beds still, but it's a stretch, and I think what we are getting nervous about are times where we can't accept patients in from the outside, and I think we're going to talk more about that later in the week. But right now, it is a concern for us, and when we see the rise in the 7-day or 14-day average locally and throughout the state and nationally, we know the whole system's coming under stress, and I think that's where we get really nervous. And so, again, the pillars of infection control travel with you wherever you go. And what we need is to make sure people follow the pillars. And I think, we get concerned because we know Halloween just happened. There were a lot of public gatherings, Thanksgiving, people coming together because they want to, and families trying to come together. And then the winter, as people go inside and the ability to go outside and do things gets harder, or to dine inside restaurants, it just gets harder. And so I think that's what we're looking at. And so those of us who have to work in this space every day feel that pressure, because I think all of us on this line would say in the middle of winter, we're busy, and sometimes we have patients backed up into our emergency room without COVID. Yeah. At least here at KU, there's 66 new patients, or 66 beds now occupied by COVID that weren't taken a year ago. Yeah. That's like 7 or 8% of our entire bed capacity. Let's say that number gets up to 100, and at the same, which is really very plausible, right? I mean, that's not a stretch. And think about then we got folks coming in with other problems in the middle of the winter. What are we going to do with that? And I think that's where we get really nervous. And the only way to avert that, to make sure we don't start getting into a position where we're really pinched to be able to deliver care, is to bend the curve. And we know how to bend the curve because we did bend the curve. We did that in April, and we did a great job in Kansas City. We need to make sure we keep doing that great job.
Yeah, and another point, this is not influenza, and you being a critical care doc and with your colleagues, I don't know, have you ever had more than 5 people at one time in the ICUs on the ventilator with influenza?
No, I've been here for 30 years, and that just has not happened.
It's hard to get even 3 at one time on the ventilator with just influenza, so this is just totally different.
It is totally different. Anybody who tells you that it's the same thing, that it's not serious, that's just wrong, right? It's just wrong. And what you have to do is just look at the numbers and see the information and know, who do you want to put at risk? Because this is the question. Who do you want to put at risk by acting like COVID isn't real? Who do you want to put at risk? Because you are putting people at risk. Who do you want to put at risk?
And I think to your point, when you saw everybody out over Halloween, it's not necessarily that group of the younger people,
No, it's not
but it's
kids.
2 and 3 infection cycles down the road when somebody doesn't know they're infected, but they go to see grandma or somebody else who's immune suppressed. And again, we have the holidays coming up now, and it's going to be, it could be dangerous, doing that, and 2 to 3 infection lines down the road, it does get to that vulnerable person.
All right, there you go. Any other questions out there from media? All right, hearing none, let's turn to our audience there, Bob.
All right. Wyatt said he read over the weekend that there is more evidence now that the viral dose influences how sick you are. Is that true? And if so, how does wearing a mask help?
Yeah, that's a great question. And Hawk, we've been talking about that all the time. We always thought that it was the viral dose that was doing that.
Yeah.
Raghu, what's your sense up there? I mean, you're an infectious disease doc like Hawkinson here.
I'm not entirely sure it's a settled issue, but certainly there is some data to show that higher the infective dose, higher the chances of getting ill, and maybe the mask might help in reducing that burden, the viral burden that you're inhaling. But there are so many other factors involved. I'll let Dr. Hawk explain a little bit more on that.
Yeah, no, I agree. I think it is an unsettled issue. You'll have some scientists saying, no, that's not true. If you have an infection, you have an infection. You'll have other people who say, well, maybe it is. I think theoretically we can see this conceivably because we know that when you do get infected with the virus, it does have immune evasion. So what it does is once it infects you, it will decrease your antiviral response of your immune system. So if you get a large dose of virus, and I mean we're talking logs different, compared to a smaller dose, if your body is not having as much viral load for that first infection and the ability to decrease the immune response by that much, your body will have theoretically the ability to, say, catch up with the virus maybe sooner without having all that viral damage that occurs during the viral stage of infection. So I think it's theoretically possible, and if you can really decrease the amount of immune evasion that happens with the initial viral infection, that might be something that adds to that as well.
Okay, you're killing me because this is a brand new word. I've not heard it before. Would you say immune evasion?
Immune evasion. So it evades the immune system it reduces basically your interferon response, which is one of the chemicals that your body uses to help fight viruses.
And the masking, just because you reduce the viral load that you're going to have. And by the way, if you want to see a really cool 3D kind of visual about this, the New York Times is over the weekend. I think this is free because all the coronavirus coverage is open to the public. They've got a nice 3D graphic on how masking works. It's kind of cool because it does show how the viral particles get trapped inside the fibers of the mask, and I think that's really important because you can see then if you don't exhale as much, then you can't put as much out there for other people to inhale, and I think that's really it. And then last night, just to say, I was outside, I walked the dog around 9 or 10 or so, and it was cold, and man, could I see my breath, and it was the perfect example of what a breath cloud looks like and where it goes, and you can think about when you're outside, man, all that wind's blowing, the air is moving, and it can disperse as opposed to inside when it just sits around you. So the next time it's cold, remember we said this to you before, the next time it's cold, we want you to go outside, film your breath without a mask and with a mask, send it to us. We want to see it. We're going to make a video putting those together of people discovering the art of mask wearing all by themselves. So.
Yeah, and we don't know the full infectious dose right now. We think it's probably in the range of hundreds of viral particles. So if you get hundreds of viral particles, a few hundred versus say 10,000 or a million viral particles, that could certainly add to that as well. But I think the studies are ongoing to really understand exactly what is the infectious dose needed.
Yeah, learning a lot, but still more to go. Bob?
All right. Donnie says, there are some schools that are quarantining those who have been exposed to someone who has been exposed. And I thought only exposed people needed quarantining, which is correct.
So that's a great question. What's the order of generations of people that have to be exposed? What do you think, Hawk?
Yeah, so we've certainly said, and working with our local health department and the state health department, it really it's the contact of that known case. We haven't been saying the contact of the contact, that second level. It is difficult because we know that the contact could have it and not necessarily know it, but right now it's just the contact of that known case, not the contact of the contact.
Yeah, I think people sometimes want to be really safe. I know, Larry, how do you guys do it for your own staff over at Shawnee Mission as far as contacts go? How do you handle that?
Yeah, we're doing basically the same thing. We don't, for a high exposure, for particularly somebody who's a household contact, we certainly are quarantining those people. For a secondary contact, an exposure to an exposure, we're not. We're just telling them, need to watch carefully for your symptoms, and certainly if you develop any, you need to stay home and then be tested. But it's just the primary contacts that we're actually quarantining.
Yeah, and I think that's so important. And if you have symptoms that makes you feel a little sick, then you have to get tested. And so, last week I had a sneeze and I had a little bit of cough. I was like, uh-oh, so I got tested. I was negative. Came right back. That's the good thing.
Yeah.
And I think that, we just need to do that because the goal of being tested is to get you into treatment if you need treatment, but also to tell you to stay home and protect everybody else so you don't make anybody sick. And I think that's the key. And the reason we wear masks so much is because oftentimes we don't know that we have COVID and we could be spreading it to others, and the mask is the way to help us reduce that spread. Bob.
A parent from Johnson County who wants to be anonymous says the Department of Health and Environment recommends canceling indoor winter sports. Should they be? She says it seems, or he, I don't know which, seems like the well-being of the kids isn't being considered. They need socialization and physical activity. What do you say to that?
I think so we've tried to stay in our lane by and large. It's a big debate. And I saw the letter, read it, and I think there are a lot of good points to be made. But again, this is as medical professionals, we can tell you how best to stem the spread of coronavirus, right? We can tell you that. And some things are easier than others. Wearing a mask, you know what, really, frankly, it's easy. It's pain in the rear, but it's easy. Canceling all kids' sports, you know what, that's not easy. And so that becomes a public policy question. What each of us can do is own freedom with responsibility so that we have the freedom to choose to go to the store, to go shopping, the things we want to do. But you got to do it with responsibility. And the way you do that is frankly to wear a mask, keep your distance, wash your hands, all the things we always say. I don't know that we want to be in a position of telling policymakers that kids' sports should be open or closed. What we would say to them is, if you're going to go do kids' sports, is make it as safe as you possibly can. And it's clear that if you work at keeping things safe, then you can do a better job. And a shout out to a couple of high school football teams in the area that have demonstrated that, led by Rockhurst, which showed, hey, what happened when a kid tested positive and some other kids popped up? They canceled their season, even though they're a good team in the midst of the playoffs. And then Lee Summit did that, and so did North Kansas City. I think I have each of those teams right. And so that's a big deal for schools to say, we're going to cancel this because we have a positive case and we want to prevent an infection, we want to prevent other kids and people from getting positive. Right thing to do. I applaud that. Whether or not it's right to cancel an entire indoor season of all high school and youth sports, I think that's a hard question, and I think that it's a public policy question. The reason it's a public policy is you have to weigh all the different aspects of it. Mm-hmm. We can tell you the medical aspect of it. I'm going to leave it to others to try and talk about the social aspect. I don't know. Let me ask some of the other guys online. Mark, what's your all thinking at Truman around this question?
Well, I pretty much agree with everything that you said. I mean, I think the key, once again, as we have talked about continuously, is if you're going to do it as safely as possible. And we've talked about those key pillars that people need to follow. So.
And Larry, you must have been hearing some of that controversy over with Advent Shawnee Mission.
Yeah, certainly we have, both from a school standpoint and a sports standpoint. I agree also with you. I think that that's an issue that's difficult. We as medical professionals can give the medical aspect. I think others have to weigh in on the other aspects of that. And the bottom line is that if you're going to do those kinds of activities, we have to do them as safely as possible, and I think that's the best advice we can give at this point.
Yeah. So I think that's right. And I think things get more out of control, then we have to reevaluate it. But you have to evaluate it at every point at a time on a spectrum with how the infection dynamic is working in the city. And I think, we're all concerned about what the winter is going to bring. I mean, all right, I think that's a real concern. I think, we're nervous about what's going to happen with hospital census. We're nervous about what's going to happen with COVID-19. And we're nervous about all the ways that different things and activities can contribute to that. So we'll have to play a little bit in terms of watching how this travels. I think that people say, "Oh, you're not really answering the question." Actually, no, I think we really are answering the question. We're saying we're medical professionals. We're going to tell you that masking works, social distancing works, small size crowds work, and then it's up to public policymakers to take that information and decide how critical some of the things that balance that are, including socialization and mental health. Oh, that's a real deal, right? That's a real deal, and we just have to decide how to do it. And then if you're going to do things like indoor sports, you got to do it safely. There are clear differences. Having a big crowd in an indoor sports arena close to the floor and things like that, not safe. So you can do things to keep it a lot safer, and that's what you have to do. Bye.
Isaac says, I read recently a study saying that natural immunity could be at least 5 months or longer. What do you say to that? Do we have any current information yet?
Roger, what are you thinking about the natural immunity post-COVID?
Yeah, I mean, the studies are still coming along as time passes. But as we know so far, majority of the people who have recovered from COVID seem to have their antibody responses at least persist until about 5 months or so. Or more. But there is, of course, additional, as you know, immunity beyond the antibodies as well that we are not measuring. So that is most likely. But having said that, there have been occasional, in a handful of cases of a second infection that has occurred within that time frame, but it's rare. In general, it seems to be true that immunity seems to last anywhere from at least 3 to 5 months for sure.
Hawk, anything?
Yeah, no, I agree with all that, absolutely. The case of reinfection, we don't know. Is it 120 days out? Is it 60 days out? There have been cases of that as well. We think that the more severe disease you have, you may have higher antibody titers. We don't know if the higher antibody titers and the immune response is leading to that severe disease, or if the infection is leading to the higher antibody responses. To Ragu's point, we just don't know, but there are other things besides antibodies. There are the memory B cells which create the antibodies. There is the memory T cell response that create actions as well. So it's not just the story of the antibodies. We know from regular or typical coronavirus infections, there can be reinfections within 6 to 12 months or 6 to 12 to 15 months. So we know that happens too. Overall, we are still researching that, and that is one of the major questions that has yet to be answered, but there continues to be new data every day.
All right. Marion says, is it safe and recommended for older people to receive the pneumonia vaccine now?
Oh, I don't think yes. In fact, I think it would be unsafe not to receive the pneumonia vaccine, don't you think?
Yeah, absolutely. Talk with your medical care providers. There are 2 major pneumonia vaccines, and those vaccines are against strep pneumoniae, which is a streptococcus, which is one of the most common causes of pneumonia. Again, pneumonia can be caused by viruses, bacteria, fungus. This will help protect against that. So talk with your healthcare providers, and you can decide and determine which exactly one you need. You need both of them most likely, but it just matters, have you had them before and things of that nature. So let's talk with them, and it is completely safe. It's just the piece of the bacteria.
One more.
All right. Payre, and this is one we're probably going to get a lot of now that we're into November, wants to know, what are your thoughts regarding a Thanksgiving dinner with 3 small bubbles? We have a small family. Here goes. 80-year-old parents at one table, family of 3 at another table, family of 4 at yet another table, all spaced apart, literally in different rooms, and masks worn while getting food.
Larry, what do you think? I haven't picked on you for a while, Larry.
Oh, yeah, that's a fun one. Those are tough questions. I mean, if you're actually going to do all of those things that you described and really put people in different rooms and wearing masks, I don't see that you're going to have. You're making it absolutely as safe as possible. I think that and honestly, only problem with that is that most people would say, well, you really cut down on the socialization part of that as well if you're putting everybody in different rooms. But I mean, I think the smaller you can keep your Thanksgiving bubble celebrations, the better. You know, it really probably depends on what you've been doing with your family and the family members over time. If you're seeing people on a regular basis, then I think getting together for Thanksgiving probably isn't much different than what you've been doing. But if you start including a lot of people in that group that you haven't really been socializing with, then you're just increasing your risk.
I think that sounds like a reasonable thing. Mark, what thoughts do you have about that?
No, I agree with what Larry said. I mean, I think that, I mean, clearly as the holidays approach, folks have to think very carefully about their gatherings, and I think clearly the smaller the better. Certainly not extending far outside of your bubble or trying to limit how much you do that. And then if you're going to do it, and obviously depending on the weather and all those things, once again, I mean, if you're able to gather outdoors, that would be better than indoors, but of course the weather may not permit that. But then otherwise wearing masks all the time, except when you're eating, and if you're going to eat, be sure you're very well socially distanced.
Yeah, and I think, Raghu, your thoughts?
Yeah, I agree with what's been said, but if you're, taking some calculated risk like that and you're preparing with everything that you're doing, I would throw in an additional thing that you can think about, maybe considering a couple of weeks prior to Thanksgiving, trying to stay away from everything else is essentially self-quarantining yourself of those, 3 groups that might add an additional layer of security.
I think that makes great sense. And Hawk, the 80-year-olds are the ones that risk in that conversation, I think, that I heard.
Yeah. I mean, Raghu stole my thunder. It's a little bit of the ID thinking. So I think you start the pre-holiday. You know, if you can isolate or reduce your interactions with other people and other groups for 10 to 14 days prior to that, you're reducing the risk. It's not totally eliminating the risk, but trying to do those things can certainly help. But we know when people get together, some of those things won't always be followed to the T. So it is a good plan and a risk reduction, but just understand that it will not eliminate the risk.
Hey guys, I just want to say thanks to Dr. Raghu. I did get from Liberty Hospital, Dr. Mark Steele over at Truman, and Dr. Larry Botts at Advent Shawnee Mission. Thank you all for joining our call today. It is always a pleasure to have you on. I think it's great for our community to hear from this and know that we're all in this together. And just as CMOs and hospitals, we're trying to work together to help keep you safe. And I think this is a great demonstration of that. So thank you guys for being on today. We appreciate that. Hey, tomorrow, KU professor Donna Ginther joins us to update her research on mask mandates. And we hear from a 38-year-old mother of 2 who supports mask wearing after catching COVID-19. Although her family did not get too sick so far, she encourages everyone to wear a mask, and she shares her reasons with us tomorrow. I also want to thank Jo for sending in her breath cloud challenge. Let's watch and see what happens with this for a moment.
See? No breath cloud. Masks work.
That's exactly right. No breath cloud, masks work. Check it out tomorrow or tonight or whenever the weather gets cold. Get out there and do this same demonstration for yourself. Send us your videos. We'll put you on. I think it's really important for us all to realize that masks are not a political weapon. And I can promise you that if you're a Republican or a Democrat, every one of you wants to wear a mask when you're inside the hospital. You want your surgeon to wear a mask when they're doing an operation on you, because masks work. And that's what we have to remember, because ultimately we are truly in this together. So thanks for being with us today, and remember, until we see you tomorrow, there's still no place like home. Go vote. Voting is safe. You can do it. It's the right thing to do. And the country, we all need to hear your voice. So thank you all for being with us today. We'll see you tomorrow.